light.
So how does it work?
During our times of ward round in major government hospitals, we interacted with YUMBE hospital staff who confessed using Boda lights as major lighting instruments in the main theatre. Dr. Yasin Sewanyana, the medical superintendent here, happily reveals this is their major scientific innovation amidst a biting power scarcity challenge which has saved many lives. The facility has not had power for as long as elders here can remember and has no budget for maintenance.
This one is a motorcycle light. It has a less power consumption compared to these other theater lights, conventional ones. And so it was connected to that other part and then connected to a solar battery that would provide power during the operation. Recently we got a solar system installed, but it also runs for a few hours in the night and gets off. So power is a very big challenge. We hope maybe power could be extended from the national grid to help the hospital situation.
Dr. Elioda Tumwesiji, the Minister for Health, was left in shock. Every patient due for operation must report with 40 liters of water daily, or else they find another hospital.
Had a water pump, but because of old age, most of these water pipes from the water pump are leaking and they need overhauling. So this causes crisis. It forces us actually to send patients to buy water, to fetch water for theatre operations.
In August, NAKIFUMA residents in Champisi sub-county lamented how they were living in great fear after gonorrhea attacking both the young girls and their mothers. The angry residents insisted the dangerous and embarrassing disease was being spread by Chinese investors who are carrying out stone quarrying in the vicinity. Mothers here narrated how their little girls had fallen prey to Chinese engineers who, though could not speak any local language, used sign language to convince their children into live sex.
The Chinese are going to cause us disastrous problems. We are getting gonorrhea. Before we know it, HIV will be high here.
The science community registered the following as major breakthroughs on the local and global scene. There was a ray of hope and flashes of smiles after the World Health Organization announcing that scientists had discovered an Ebola vaccine which registered 100% efficacy. World Health Organization confirmed that VSV EBOV Ebola vaccine was completely effective after it surpassed the 50% vaccine efficacy needed by WHO before approving any vaccine. This vaccine, announced at the beginning of August, came in after the Ebola virus, killing more than 11,000 people in 3 West African countries. Over 4,000 close contacts, including family members, neighbors, and co-workers, voluntarily participated in the trial, which was believed to provide the world with a solution to the notorious savage killer Ebola. Marie Paulette Ken from the World Health Organization confirmed it was an extremely promising development. African scientists announced that they had finally found a vaccine for the world's leading killer, malaria. The momentous breakthrough was announced in the Ugandan capital of Kampala on Friday, July 10th at a meeting of leading researchers who had been working on this project for 5 years. The scientists confirmed that the RTS-S vaccine met 53% efficacy, surpassing the World Health Organization's 50% recommendation for every vaccine. After many people dying with unbearable pain from diseases like cancer, HIV, among others, young Ugandan doctors took a local laboratory where they are manufacturing morphine, a distinctive pain reliever for life-threatening illnesses. These young brains took up manufacturing this wonder drug after the World Health Organization authorizing Uganda to train and equip health personnel on the use of this drug.